Are you somebody who struggles with alcohol use? If you are, you're going to stick around and watch what I got for you. My name is Sulman Mirza. I'm a psychiatrist with a board certification in addiction medicine, and I'm going to tell you about something that changed the way that I work with patients who struggle with alcohol use disorder. When we turn on the news nowadays, all we hear are things about the opioid epidemic. We talk about people abusing Adderall. We talk about people with Xanax issues, fentanyl. But you know what causes the most problems, has the greatest impact overall of all the substances? It's alcohol. When I was going through training, it seemed really hopeless about how we're going to help people with this. They would say you need to be doing things like abstinence, or you need to be doing AA, Alcoholics Anonymous. And granted, these things can work for some people, and then when they work, they're fantastic. But the success rates that we're having, looking like 10% and less than 10% often. There are medications that are out there that can help with alcohol use. The two ones that are most commonly used are antabuse and Campral. Antabuse, or disulfiram, is a medication which is there and essentially is aversion therapy. And a lot of times people will come around to having to use it after they had something like a DUI or a DWI, and they're legally ordered to go to a place, take this pill to start their day. What happens when someone drinks alcohol while they're taking antabuse is they get violently sick and they get throwing up. So this doesn't always work, right? Because a simple way to kind of get out of dealing with the consequences of drinking is to not take the pill. So on an outpatient basis, when people want to do this, they simply just don't take the pill. The other medication is Campral, or acamprosate. What that's supposed to do is essentially suppress your desire to drink, so reduce the cravings to drink. And it can be very effective. The main problem, however, is that it takes 2 pills 3 times a day that you have to take for as long as you want to stop and reduce the cravings for drinking. When we're using any kind of medication, when we have to do something multiple times a day, the adherence as a whole goes down. So Campral, while it can be really great, people don't stick with it. So what works? The one thing that I found in my practice that's really changed the way that I practice is the Sinclair Method. And the Sinclair Method is something that touts to be 78% effective. And I find that number in my practice to be about right. And it was developed back in the day by a psychologist named John Sinclair. What it essentially does, it brings us back to the good old psychological terms of operant conditioning. And we have to remember these things. So we're gonna go back and talk about the confusing operant condition real quick. When we're talking about operant conditioning is reinforcement. So the concept of reinforcement, and basically what you're doing, and especially positive reinforcements, what you're doing is you're rewarding a behavior in order to continue the behavior. The other concept when we're talking about this is extinction. So what happens is a non-event, something doesn't happen or nothing happens, which leads to a lack of reinforcement, which ultimately comes to a reduction in the behavior. This is different from what we call positive punishment, where we add something in, again, a problem that occurs in order to reduce the behavior. Going back, this is what antabuse is, which essentially we're adding in nausea and vomiting in order to reduce the behavior. Dr. Sinclair then decided that he was going to use a medication called naltrexone with the idea of having pharmacological extinction. What researchers found over time is that in most cases of people, alcohol reinforcement involves the opioid system, specifically the mu receptor that's there. This receptor is involved in the reward pathway, the mesolimbic pathway of the brain, and the release of dopamine, which we know makes us keep doing things and something that we crave. Dr. Sinclair then said, hey, if we take naltrexone and we use it to block the mu receptor in the brain, what we're essentially going to do when we drink alcohol, we're going to block the reward that comes from this. We're going to block reinforcement because we're not getting that positive, that good feeling that comes from it. If we have the non-event of not having a reward, then we're not getting the reinforcement, which leads to, over time, as this happens more and more, extinction of an event. So what does a person do in reality? So what we see is that the person will take the naltrexone, they'll wait an hour for it to start to be in their system and for it to work, and then they'll start to drink. And when they drink, the reward doesn't come, And again, that over time, the extinction comes up that people say, if I'm not getting something from this drinking, why would I continue to drink? And I've seen very drastic improvements on day one. People will say things like, hey, I drink a bottle of wine usually every night. And then when they've come to me the next time, they say, hey, I took the pill, I poured a glass of wine, and I couldn't even finish that glass of wine at all. Massive differences. So why is the Sinclair Method not taught to people? Because the controversy is that you're telling somebody who's coming to you who wants to stop drinking that we need you to drink in order that we learn how to not drink and to lose that pleasure. Family members, when they hear this, they get a little bit upset. They're like, we came to you to get us to stop drinking and you're telling us to drink more. And we have to say, trust the process. We have to play it out over time so that we unlearn these behaviors that probably didn't show up overnight. They're not going to go away overnight. One of the other things that's really important to note about the Sinclair Method, it is not always there with the intention of getting you to stop drinking totally. It is there to reduce problem drinking. So ultimately, what we're hoping is that people were able to get to the point where they're not having binge drinking episodes or heavy drinking episodes. It allows people to have that dream per se of having, I want to be able to go out with my friends, have one or two drinks and be done with it. A lot of my patients have said to me that they want to have other people who are going through a similar process. When I was out doing lectures and I would bring up the Sinclair Method, one of the things that was really interesting or would be really helpful is that I pulled up a video from YouTube about somebody who was going through it. And one of these people was somebody named Katie Land. She and a friend of hers, Karen, who were both people who went through the Sinclair Method, came up with something called Thrive Alcohol Recovery. And they developed something called the Alcohol Freedom Program, which is ultimately is a courses, there's coaching, there's forums, and there's support. So if alcohol is something that you've been struggling with and you feel like, I've tried everything else and nothing else is really working, and you haven't come across the Sinclair Method, give it a shot. It's something that I've seen be life-changing for a lot of people, and it can make a huge difference in your life.